Hello, I'm Dr. Craig Stern of Pharma Pharmaceutical Consultants. Today we'd like to talk about PMPM. Sounds like an interesting kind of abbreviation. I live in a world that has a lot of abbreviations and acronyms, frankly, probably to keep a lot of other people out, so it makes it sound complicated. Sometimes we overcomplicate it. PMPM is perhaps the most fundamental indicator in healthcare benefits, and I want to talk about it for a moment. Suppose you have a very large group of people, and that large group of people costs a certain amount of money, let's say just for argument's sake $1 million, and they use a lot of healthcare services, be they drugs, be they hospital services, emergency room services, physical therapy services or otherwise. And suppose you have another group, and that group spends $5 million, and they also use all these different kinds of healthcare services. So the group that spends $5 million sounds like a group that is more expensive, and as a result of that, they would be a group that you think has a greater number of problems, a greater wealth of problems, things like that. Well, somehow we need to be able to compare one group to another group and to get some comparisons that make sense between the two of them. The most fundamental way of doing that is to count the number of all of the people that have been insured, all beneficiaries, not just employees, but their spouses, their children, and otherwise. Count that, and effectively take the total amount that we spend and divide it by the number of people who actually have signed up. They have paid in, they are beneficiaries of the total service. And if we do that with each one of these, whether it's the $1 million group or the $5 million group, we then have a number that allows us to tell that this group costs $35 for every individual per month, and this group costs $100 for every individual per month. Well, if you do that, then you note a couple of things. One is that the group that has, say, $1 million and has $35 for every member per month, and you certainly have to keep things in order so that you have the same amount of money in the time period versus the number of people in the time period. But when you do that, you're effectively taking the cost of all of the healthcare services and you're putting it into one number, a PMPM. And this kind of makes an equation that is relatively easy to follow. It's kind of a simple audit trail. People pay so much money every month for their premium to get healthcare insurance. And then out of that premium, money is spent to pay for drugs, to pay for hospital, emergency room, and all the other kind of doctor's visits, everything else that goes on. That number then allows you to compare one group to another group, and it allows you to understand, at least in a gross way, from a dollar way, what's happening. Now there's additional things that can be done because you want to know more than just the cost. You want to know, for example, what's the utilization? How often do they utilize the service? So out of that, as part of that PMPM, or per member per month cost, there's also built-in information that is teased out in order to identify how many doctor visits, how many hospital visits, how many emergency room visits, how many drugs, how much physical therapy, how much labs, x-rays, etc. So we have a number that allows us then to work our way down the cascade in order to find more information about one group versus another, and allows us to compare one group versus another. There are certainly downsides. Severity of the patient population is certainly an issue. So is age and gender and a host of other issues. But at the end of the day, this is one of the most fundamental indicators of all. I thank you for taking a few minutes to spend with me today. I wish you good health, and I hope that next time you'll come back with questions and with things that you're interested in. Be well.